Now there are the two meridians which I told you, the ventral side of the body, the other one is the dorsal side. So to regulate that, I told you there are the monarch for all the organs, or the so many organs. I told liver is the mother for all the organs, heart is the mother for all the organs, heart is the king or the monarch of all the organs. Whereas in here I wanted to tell you the in meridians are regulated by the conceptual vessel or the Ren meridian as well. So now we understand there are the ventral side of the body. What are the meridians are existing on the ventral side?
Liver, stomach.
Yes?
Liver, stomach.
Good. Yes.
Ren meridian.
Yes. So when we understand the ventral side of the body, that means you look at about the chest, brain, then lungs, heart, spleen, liver, kidney, and stomach meridians are the ventral side of the meridians. Whereas in the dorsal side of the meridian, this also dorsal side meridian. So those meridians are the tenointestinal, that's known as a vesical meridian, or the small intestine meridian, then triple warmer, large intestine meridians, and stomach, and then gallbladder and urinary bladder. Those meridians, especially the back meridians, are regulated by the spinal cord meridian, that's called as a Thumai meridian, whereas in the ventral side of the body, meridians are regulated by the Ren meridian. Ren also it is a kind of the mu means is the front side, front of the anterior midline of the body. This is the ventral midline of the body, to be known as a, there is the muscles are there on the anterior side of the muscle. There is a layer of the rectus sheath, rectus abdominis muscles are there. In between the rectus abdominis muscles is a central part, to be known as a central line, to be known as a linea alba. So that entire area, all the acupuncture points are existing, that to be known as a Ren Mai. Ren also is the friend, Mai is the vessel, right? And then the another name to be known as the conceptual vessel meridian as well, because on the below the navel, the entire meridian to be divided into three segments. One is the below the navel, the second one is the above the navel, below the diaphragm, and then above the diaphragm there is the entire area, the whole conceptual vessel divided into how many segments? Three parts, from the face, head and face, to the chest cavity, from the chest cavity to the navel cavity, from the navel to the pelvic cavity. So from here to here, the entire meridian has been regulating. That means all the internal organs are situated on the ventral side of the body. So therefore the conceptual vessel is mainly, the name has been kept by the, not the Eastern medicine, but this name kept by the modern medicine or the Western medicine concept. But however, there is the Ren Mai is the another name. The next name to be known as the anterior midline of the body, anterior midline meridian. The another meridian is the among the 8 extra meridian, Chung Mai. Chung Mai is the another meridian called as a vital meridian, thoroughfare meridian, and also there is the energetic meridian. So even, and also the Chung Mai meridian known as a aorta meridian as well. Aorta, that is the biggest artery in our bodies, aorta meridian, also known as a Chung Mai meridian. And of course is the Thai Mai meridian, to be known as a belt meridian or the waist meridian. So when Yang Chio Mai and then In Chio Mai and Yang Wei Mai and then In Wei Mai, these are the totally 8 meridians. So this is related to the venous system, especially the Yang Chio Mai and then Wen Chio Mai are regulating to the venous system. Especially the Renmai name also I have given, so that means that the great authors has been mentioned, that is the vena cava also, that to be considered as the international level, right? So Renmai meridian also known as the vena cava meridian, but where is the superior vena cava, where is the inferior vena cava, what are the points will be connecting to the inferior and then superior vena cavas. I look into that, all the points from where to where, that having the junctional points, where the inferior vena cava communicating points, where the superior points are communicating to the cardiac system. So that's the reason we have mentioned as a vena cava meridian as well. So hopefully we look into that among the 8 meridians, but there are the only 8 points are regulating by activating these 8 meridians. So all of you, I hope so, know, because already we completed all the principal meridian acupuncture points. So 8 points are regulating to the entire system of the body. As I told you, it is the reservoir of the meridians, or the reservoir of the points, or the master points, or the confluential point, or the specific points to regulating to that particular meridian and the particular channel and particular organs internally in our body. So those points to be known as a Nikuan and then Kungsun, Lichu and then Sauhai, Huxi and then Shenmai and then Veikuan and Futlinchi. So that means these are the 8 points. One is the P6 and then spleen 4 and LU7 K6, SI3 UB62, Sanjo 5 and GB41. These are only the 5 points. Only the 8 points. Right? So I'll repeat once again. One is the P6 and then spleen 4. So P6 is the in Veimai and Chungmai. In Veimai and Chungmai is the combination, because each and every meridian having the pair meridian, right? So how the lungs is connected to the colon, how the liver is connected to the bladder, gallbladder, so on, but this also paired meridians as well. So now the Ren meridian is connecting to the Dumai meridian. Of course is the yin and yang, but however in the extraordinary vessels it's communicating to the 2 meridians. One is the in Wei Mai, or the in regulating vessel, communicating to the Chung Mai. That means the vital meridian or the thoroughfare meridian or the Chung meridian. So that means the P6 and then spleen 4 is the connectivity to regulating to the upper geo and also to the lower geo. That means P6 and spleen 4. If you apply P6 and spleen 4, only 2 points, certainly having the great impact to treat for the upper cavity related disorders and also the abdominal and then pelvic cavity disorders. You look at about the male and then female disorders. Male disorders can be treatable by activating to the Nikuan. Most of the female problem to be treatable by activating the Kung Sun. Kung Sun is the spleen 4. The name itself is the grandmother and then grandfather. So the name has been how the Huang Dis is the grandson names to be known as a Kung Sun. The name, such a beautiful name, the name has been kept, that belongs to the Chung Mai, that belongs to the vital points are existing in our body. One is the spleen 4. If the woman keep giving the moxibustion on the spleen 4, certainly the patient will lot of changes for all the women related disorders. That's called as a penetrating vessel. Penetrating vessel, also another name for the Chung Mai, thoroughfare vessel, vital vessel. There are the 4 names for this meridian, right? Where that spleen 4 point is located at the base of the first metatarsal bone in the depression before the cuneiform bone starts. So that particular area, spleen 4 point is located. This is spleen 1, 2, 3, 4. You look at about the metatarsal bone, head of the metatarsal bone. In the depression, you just press and feel, you can find the hollow depression base, that to be known as a spleen 4 point. So spleen 4 for the all the female related disorders, because you note the penetrating vessel, it starts from the kung sun itself, that ascends to the upward direction on the medial side of the leg, and then it reaches to the groin region, it reaches to the pelvic region. All the genito-urinary disorders can be treatable by activating that particular point. So spleen 4, however, that point also to be known as a, which is the lower connecting point of the spleen?
2.
Good. Then?
Spleen 21.
Very good. Then?
Spleen 4.
Yes, wonderful. Spleen 4 is the lower connecting point. Spleen 21 is the major lower connecting point. So that means is a major collateral. But however, that is the lower connecting point communicating to the stomach and the spleen and pancreas. So therefore, we remember that really useful to treat for the numerous diseases. Even one single point treat for the hundreds of the diseases. This I can say is the optimistic level. We can use these 2 points are recommended. Now we look into the Li Chu and then Sao Hai, that is Lu7 and K6. So certainly treatable for the even the ventral side of the body. Anything there is the ventral side, there is a lungs related disorders, cardiac disorders, abdominal disorders, pelvic disorders, and certainly we can connect the one point, that is the Li Chu, is the Lu7 is the communicating point to the ventral side. There is a combination of this is in Chio Mai, that is known as a K6 point Sao Hai. So now 2 points Lu7 and K6, both the points you can apply. You can treat the number of the diseases, hundreds of the diseases can be treatable by activating the Lu7, and then K6 is the combination. Because the in Chio Mai, the origin of the energy starts from the medial malleolus region. So that also ascends to the upward direction. But however, some of the theories understands that there is no channel or meridian or pathway. Some theories says it ascends to the upward direction of the energy as well. When we understand the another 2 points to be known as a Shen Mai and then Hook Si, that is Si3 and then UB62. Both the points to be known as a, one is the Yang Chio Mai, is the Shen Mai UB62, and then the Tu Mai is the governing vessel meridian, that's to be known as a 0 meridian or the spinal cord meridian, DU meridian. I'll try to teach you on the 10th of the September. Yes, 10th of the September I'll take the Duma meridian. Later I'll look into that extraordinary meridians. So you will going to be amazing to know all these points, hopefully before completion of my class, and will be the very imperative notification to all of you related to the examinations. So hopefully you at 2 o'clock I'll try to announce you when our examination will going to start. So now the timetable will be given. The second one is the what I told you, the DU meridian is regulating by one single point to be known as a Hook Si, Si3. Si3 is the confluential point for the spinal cord meridian, and also there is a coupled meridian, paired meridian to be known as a Yang Chio Mai. Yang is connected to the Yang, in is connected to the in, right? There is no communication to Yang to in into Yang, but of course Yang to Yang, in to in. Now I told you Yang Chio Mai is connected to the UB62, and then Du Mai meridian or the DU meridian is connected to the Si3. So both the combinations you can use it. You look at about the Si3 is the lateral part of the or the medial part of the or the extreme outside meridian to be known as a Si meridian. Shen Mai UB62. UB62 is the outside meridian. right from the sole of the foot region. This also on the hands is the outside, on the leg also outside meridian. There is a combination. If you wanted to treat SI3 and UB62, all the dorsal region of the body, all the back side of the problems can be regulated by activating this particular point. Now we understand the next level of the point to be known as a Veikuan and then Su Lin Chi. So Vei means is the stomach, and Vei means another meaning is outside. Kuan is the gate. Ni means is the medial, Kuan is the gate. Ni Kuan is the P6. Vei Kuan is the outside of the gate to be known as a triple warmer 5 or the Sangio 5. Sangio 5 is the point is to tune proximal to the dorsal wrist crease, midway between the radius and ulna. These points are located, right? 2 points are located here. So now we should use these two. The one point is the Sangio 5. The combination point to be known as a GB41 is the communicating point. That point to be known as a Yang Wei Mei meridian as well. Right? So hopefully we understand there are the 8 points. This will be certainly one question in your examination. Write down the confluential point. Confluential point meaning is to regulating to the extraordinary meridians with the support of, with the help of principal meridians. Right? Both are combined together because there is no acupuncture. Separate points are situated through the extraordinary vessels, but extraordinary vessels only the Renmai, Dumai meridians points are there. Apart from that, the 6 meridians, they don't have their own respective points, right? Meridians are existing, but there is no points are existing in that. But however, these points are helping to that particular point to regulate that. But before that, the principal meridians are supported, taken by the extraordinary meridians, because it is the storage meridians and also reservoir meridians, right? So hopefully we understand. We were completed some of the extraordinary vessels, but in order to understand the pathways, which is not so imperative, but however keep it in your mind, these are the points. So 8 points are regulating to the extraordinary vessel, which I told you nearly 72 meridians are existing. Among them the 12 are the principal meridians. 8 meridians to be known as a extraordinary meridians, collectively to be known as a 20 meridians in generally. When we wanted to understand to the deeper level, then we understand 72 the curious meridians are existing in our body. How there are the 72,000 nadis are existing based on the Ayurveda. How the nearly 100 trillion cells are existing in our body. And all those things are supported by this kind of the meridians collectively. Now we understand Tu means is the brain and then spinal cord. Ren meridian to be known as a yolk sac in the embryo. Ren meridian, that I told you, the conceptional vessel meridian, that is the yolk sac in the embryo. There is a sac is there. So that sac to be known as a ectoderm, endoderm, right, mesoderm. So these are the 3 derms are there. One is the ectoderm, is the outer layer of the embryo, and then mesoderm is the central layer of the embryo. Then endoderm is the interior part of the layer to be known as a endoderm. So these are the layers are covered by the conceptional vessel meridian, also based on the perspective of the modern medicine. Thigh is the energetic movement of the amnion around the yolk sac. So that's called as the amniotic fluid. Thigh meridian. Thigh meridian also to be known as is the belt meridian or the waist meridian or the pelvic meridian also. Then yang chiomai, ascending tract of the spinal cord, and then cerebellum. Yang chiomai, now you keep it in your mind. Yang chiomai is the one particular point. That point to be known as I told you already. Yang Chio Mai. You look at about Yang Chio Mai, ascending the track of the spinal cord, and then cerebellum. Cerebellum, very good. Then another one point, good. UB62. Yang Chio Mai is UB62. That means there are the two brains. One is the big brain, the other brain is little brain, right? Little brain having the major functions, that having all the movements in our body, walking. If you are walking precisely normal without drunken people, right? You walk normally, that means your cerebellum is functioning precisely good. When the person is get imbalances on the walking, like a drunken people walk, like ataxia conditions people walk, then you understand it is connected to the little brain got the atrophy, so which leads to that problem. But a little brain problem, that means is the cerebellum are regulated also by the one point, that point to be known as a Shen Mai. Shen is nothing but is the spirit. Spirit. Mai means is the, again it is the connectivity, or it is the meeting point, it is the channel communication. So that means it is the spirit is communicating on the spinal cord level, at the same time which is communicating to the cerebellum as well. So UB62, where is UB62 point is located? On the lateral malleolus, right? So which is the malleolus? This is the lateral malleolus, right? This is the lateral, pinky toe side is the lateral malleolus. You just distal to this. Distal to the lateral malleolus, there is a hollow depression, there is a tendon as well. So that particular in the depression, you can find the particular point is UB62. So once you activate UB62, of course that's the reason spirit point is always is good to calm down the Shen. Calm down the Shen is the spirit again. So that means the person doesn't sleep. The sleeping protocol, there is a point to be known as Shen Men, Shen Mai. This is the combination. When we study about the Professor Anton Jaisurya's book, so he has written Shen Men, Shen Mai for the sleeping protocol. Right? Shen Men. Shen means is the spirit. Men means is the gate. Right? That is H7, where the pisiform bone is there on the wrist region. Above the pisiform bone, H7 point is located. If you activate this point, that will be really helpful to calm down our spirit. At the same time is the Shen Men and then Shen Mai. Shen Mai is connected to the, further it is connected to the Shen, again it is the Shen spirit itself, which is communicating to the little brain as well. You know the little brain area, there is, hopefully when I teach you about the extraordinary points, Anmiyan 1, Anmiyan 2. Anmiyan means is the name itself is indicating peaceful sleep. Right? The peaceful sleep to be given by activating to the Anmiyan 1 and 2. Once we activate those points, certainly the patient will feel comfortable like he sleep very well at the night time. So therefore we understand there is a one point here that where is located on the cerebellum region. On the cerebellum region, the points are located in this region. Hopefully the in Chio Mai and then in Chio Mai, that is Yang Chio Mai, UB62, in Chio Mai. Yang means you understand Yang point, that is UB62, our urinary bladder belongs to the Yang. Now in Chio Mai, in means is the in regulating vessel, in Chio Mai, so that means is the in organ is communicating here, that means is K6 or high. K6 is the origin, that is means is the in Chio Mai, descending the tract and the parasympathetic system, especially the vagal nerve, that means is the vagus nerve also communicating by activating to the in Chio Mai. So Yang Wei Mai, the fine intracellular network of the nutrition and then communication. Yang Wei Mai. So that means GB41. So foot lin chi. So this is in fact also to be, there is a belt channel, that is also to be known as a Wei Kuan Sanjo 5 and then GB41 combination points to regulate the entire belt channel. Of course, at the same time, this is in fact is the intracellular network of the nutrition and then communication. If the triple warmer is good, then that will be supplying to the nutrition supplement to the entire system of the body through the transportation system. Because when the triple warmer mechanism will get obstruction or the blockages, so that time there is the nutrition supplement also gets blockages. When we look into that Sanjo 5 is the luvo connecting point which is communicating to the pericardium and then triple warmer. If the triple warmer is good, then the upper, middle, lower geo also good. So therefore it is the nutrition and then communication also to be taken place by that particular meridians. Tu mai, yang chio mai, ren mai, in chio mai, chung mai, in wei mai, tai mai and then yang wei mai. These are the 4 paired meridians as well. When you wanted to write down, so this kind of the combination, now tu mai and yang chio mai communicating points. Please come on from your end. The tu mai and then yang chio mai communicating points to be known as a 2 points. What are those? Wonderful. SI3, please come on loudly. SI3 and UB62. Wonderful. Renmai and then Inchiomai. Renmai and then Inchiomai. Combination points to be known as a wonderful. LU7 and K6. Both are combination of the points. Chungmai and then Inwei Mai.
P6 and
Wonderful. P6 and then spleen 4. Right. Tai Mai and then Yang Wei Mai.
SG5 and GB41.
Sanjo 5 and then GB41. Come on, all the points in your tip of your mouth. Hopefully, quickly you just come on according to this slide. What are the points? So that all the 8 points register in your mind and try to find out where the precise locations are located. Look at about the atlas of the acupuncture and then keep it in your mind. Whenever it is possible, try to apply those points and regulate the system. Right? So come on, Du Mai and then Yang Chio Mai.
SI3 plus UB6.
UB62 is the combination of the protocol to treat for the spinal cord disorders. To treat for the spinal cord disorders. Then Renmai and then Inchiomai are regulated by the 2 points. Those points? Yes, in the Zoom also please tell me loudly so that you will register in your mind. So be focused and concentration. Yes, LU7 and then K6. So treatable for all the ventral side of the body, abdominal side of the body. These points you look at about this area to be treatable by activating from the front side to the pelvic region. These points are treatable by 2 points. What are those? K6. Then this entire area from the head to the back region treatable by SI3 and UB62. So hopefully you understand there are the 2 points. Of course 4 points were completed. The another point to be known as a P6 and then Chung Mai and then In Wei Mai.
P6 and SP4.
P6 and then spleen 4. Again the P6 spleen 4. P6 for the chest cavity. All the chest related disorders. All the chest related disorders to be treatable. All the chest related disorders are treatable by activating
P6.
P6. Then K6. All the abdominal related disorders are treatable. Then if, now I told you the ventral side of the body. If the ventral side of the body, of course I told you the Lichu and then Sao Hai, K6 and then LU7. If you do the combination LU7, K6, P6 and spleen 4, certainly can be treatable for all these points. Because the one particular point is treatable for 2 organs. If you apply the P6, you are treating to the brain and then spinal cord. You are treating to the heart and then triple warmer. and small intestine as well. So therefore when you are using the spleen 4, then spleen and stomach both are regulated. That means is the 2 points regulating to the 4 meridians or the 4 channels. Right, then the Chung Mai and then In Wei Mai, that is spleen 6 and then spleen 4 and then P6. There is the one name that's called as a, where is the navel? Navel, lateral to the navel, you can find the one point, that point is Thigh Mai GB26. So that means is the, where is your belt? Where there is the thread is there here, that rope is there, normally they keep as a one small. So that means the entire belt channel, that's called as a Thigh Mai, or the another name to be belt channel. Even the waist related disorders, and also there is the back related issues, and also the lateral side of the body treatable by activating to the 2 points, that triple warmer 5 and then GB41. Then you let me know the entire system of the body from the top to bottom, it's governed by the how many points? 8 points, right? Totally 8 points are governing to the entire system of the body. That was the amazing. The person is very dilemma to understand the physiological aspect about the diseases. That particular time called as a so iatrogenic diseases, or some kind of the, we can say, unknown cause of the diseases, idiopathic diseases. So that time we don't know the etiology, we don't know the pathogenesis, but the disease is there, the root cause is we don't understand. That's called as a idiopathic disease. So that situation, when we wanted to apply the needles, so that time certainly you can use it. This is the confluential point. When we go to the acupuncturist, some people will apply 1 needle, 2 needle, 3, 4, 5, 6, 7, so on, and some people will apply 50 needles, 20 needles, or greater than 20, 30 needles in per sitting. Then you understand, rather than putting the so many needles, definitely, even I was tried this set of the protocol using the points, 8 couple of the points at the same time, when the person is very, very complex diseases are there. That time I couldn't understand some concept. That time certainly we can use it to regulate the principal meridians and also to regulate the extraordinary meridians as well, to holistic way from the top to bottom to regulate the entire system of the body. However, when you understand there is no lateral side of the body is affected, only the person is understand the GIT related disorders and then chest related disorders, that time you need not to apply multiple needles on the back conditions points, but better you can use LU7, K6, P6 and spleen 4. These are the points. 4 points are quite enough to treat. But at the same time patient is complaining, I do have the pain on my head region, cervical region, sometimes it goes on to the back and sciatica, some kind of the issues. At the same time the radiates on the intercostalis muscle, sometimes I find the pain on this lateral position of my back region. Then you understand these points are may not required, then you can use the 4 points, that is SI3, UB62 and Sanjio5 and GB41. 4 points you can use it. That itself is quite enough. If the person at the home, if the patient asks them to continuously give the pressure, these points intermittently, morning 2 to 3 minutes and evening 2 to 3 minutes per point, certainly patient having the great impact to treat themselves, to treat for the numerous diseases.